Hello everyone, Dr. Alan Mandel here. Welcome back to my channel, Science of Healing. Let me share something that every man over 40 and every family who cares about the men in their lives needs to understand. Because when it comes to prostate cancer, one simple blood test can save a life. But that same test, if misunderstood, can also lead to fear, unnecessary procedures, and confusion. Today we're talking about the PSA test, prostate-specific antigen, and why the decision to take it is more complicated than most people realize. Not dangerous, not mysterious, but nuanced. And once you understand the science, the benefits, the risks, and the role of nutrition and lifestyle, you'll be able to make a smarter, calmer, more confident decision for your health. Let's start with the basics. Most men believe a simple blood test is either good news or bad news, positive or negative, safe or dangerous. But when it comes to the PSA test, the truth is far more complicated and far more powerful than most people realize, because this tiny number in your blood can be the difference between catching cancer early or discovering it when it's already too late. Every year, hundreds of thousands of men around the world hear the words, "You have prostate cancer." And for many of them, the disease was silent. No pain, no warning, no symptoms, just a quiet threat growing inside the body. Prostate cancer is one of the most common cancers in men, especially after the age of 50. In fact, medical research shows that roughly 1 in 8 men will be diagnosed with prostate cancer during their lifetime. But here's the shocking part. Most men who die from prostate cancer never felt anything unusual until the disease had already spread. That's why early detection matters. That's why screening matters. And that's why the PSA test has saved millions of lives since it was introduced into routine medical practice. The PSA test measures a protein called prostate-specific antigen, produced naturally by the prostate gland. Under normal conditions, only small amounts enter the bloodstream. But when the prostate becomes inflamed, enlarged, infected, or cancerous, PSA levels can rise. And sometimes that rise is the very first signal that something is wrong, long before pain appears, long before urinary problems begin, long before cancer shows itself on a scan. This is the power of early detection. Studies have shown that when prostate cancer is found early, before it spreads beyond the prostate, survival rates are extremely high. In many cases, men live long, healthy lives after treatment, returning to their families, their work, and their routines. But when cancer is discovered late, the story changes dramatically. Once prostate cancer spreads to the bones or other organs, treatment becomes more difficult. Pain increases, complications multiply, and survival rates drop significantly. This is not meant to scare you, it's meant to wake you up, because the PSA test has one extraordinary strength. It can detect risk years before symptoms appear. Years. That window of time can be the difference between a small, treatable tumor and a life-threatening disease, between a simple procedure and aggressive chemotherapy, between reassurance and regret. But here is where the story becomes more complicated. A high PSA does not automatically mean cancer. Let that sink in. Many men see an elevated PSA result and immediately imagine the worst. Fear takes over, sleep disappears, anxiety builds. But science tells us that PSA levels can rise for many reasons that have nothing to do with cancer. An enlarged prostate, a condition known as benign prostatic hyperplasia, is extremely common as men age. Infections can raise PSA levels. Inflammation can raise PSA levels. Even recent physical activity, cycling, or sexual activity can temporarily increase PSA numbers. That means a single test result is not a diagnosis. It is a signal, a clue, a starting point. Doctors don't rely on one number alone. They look at patterns over time. They study how quickly PSA levels change. They compare results year after year. They consider age, medical history, family history, and symptoms. Because medicine is not guesswork. It is pattern recognition. And here's another surprising fact. Some prostate cancers grow so slowly that they may never cause harm during a man's lifetime. Autopsy studies have revealed that many older men had small prostate cancers they never knew about, cancers that never affected their health. This is called overdiagnosis, and it's one of the reasons the PSA test must be used wisely. Because detecting a cancer that would never cause problems can lead to unnecessary procedures, biopsies, surgeries, and treatments that carry real risks: urinary leakage, sexual dysfunction, emotional stress. These are not small consequences. This is why modern medicine has evolved. Today, doctors are more careful, more precise, and more personalized in how they use PSA testing. Instead of rushing into treatment, many patients with low-risk cancer are placed on active surveillance, careful monitoring without immediate intervention. This approach protects quality of life while still keeping patients safe, and the results have been remarkable. Research shows that many men on active surveillance live for years without needing surgery or radiation. Their cancer remains stable. Their daily lives remain intact. This is the balance modern medicine is striving for. Detect early, treat wisely, avoid harm. But here is the most important message of all. The PSA test is not a yes or no decision. It is a conversation between you and your doctor, a conversation about risk, family history, age, and overall health, a conversation about benefits and potential downsides, because not every man faces the same risk. Men with a father or brother who had prostate cancer face a significantly higher risk. Men who are overweight or sedentary face increased risk. Men with chronic inflammation, poor diet, and metabolic disease may also face greater vulnerability, and age remains the strongest risk factor of all. After age 50, risk rises steadily. After age 60, it rises even faster. By age 70, prostate cancer becomes one of the leading health concerns for men worldwide. Yet many men delay testing out of fear of bad news, fear of procedures, fear of losing control. But knowledge is not the enemy. Silence is, because when cancer is found early, options expand, treatments are less invasive, recovery is faster. Outcomes are better, and sometimes treatment isn't needed at all. That is the hidden power of screening. It gives you time to monitor, time to decide, time to act before a crisis begins. Think of the PSA test like a smoke detector. It doesn't mean your house is on fire, but it warns you early enough to check, early enough to protect what matters most: your health, your independence, your future. So the real question is not whether the PSA test is perfect. No medical test is. The real question is whether you are willing to stay informed, stay proactive, and stay engaged in your own health. Because the men who take control early, who ask questions, who monitor changes, who make informed decisions, are the men who give themselves the best chance at long, healthy lives. And sometimes all it takes to start that process is one simple blood test. What you eat every single day is not just feeding your hunger, it is feeding your cells, it is feeding your hormones, and most importantly, it is feeding or fighting inflammation inside your body. And when it comes to prostate health, inflammation is often the silent trigger that sets everything in motion. Long before a man feels pain, long before a doctor detects a problem, long before a PSA number starts to rise, inflammation begins quietly, deep inside the tissues, slowly damaging cells and disrupting normal function. Medical research has repeatedly shown that chronic inflammation is strongly linked to prostate enlargement, urinary problems, and even the development of prostate cancer. It does not happen overnight. It builds day after day, meal after meal, habit after habit. And here is the truth most people never hear. Your daily habits have more influence over your prostate than your genetics in many cases. Yes, family history matters. Yes, age matters. But lifestyle is the factor you control every single day. Every bite you take is either adding fuel to inflammation or helping to calm it down. Let's start with one of the most powerful foods ever studied for prostate health. Tomatoes, not just any tomatoes, cooked tomatoes. When tomatoes are heated, they release a compound called lycopene, a potent antioxidant that has been extensively researched for its protective effects on prostate cells. Scientists have found that men with higher lycopene intake tend to have lower rates of prostate disease. Lycopene works like a shield. It helps neutralize free radicals, unstable molecules that damage DNA and accelerate aging inside the prostate gland. Without protection, these molecules can trigger mutations that lead to abnormal cell growth. But with consistent intake of lycopene-rich foods, the body gains an extra layer of defense. Think about something as simple as tomato sauce, tomato soup, stewed tomatoes, even a warm bowl of lentils cooked with tomatoes. Small meals, powerful protection. Now consider another food that quietly protects the prostate from the inside out: fatty fish. Fish like salmon, sardines, and mackerel are rich in omega-3 fatty acids, essential fats that the body cannot produce on its own. These fats are known to reduce inflammation throughout the body, including the prostate. Inflammation is like a fire. Omega-3 fats act like water. They cool the system. They calm irritated tissues. They support healthy blood flow. Research has shown that men who regularly consume omega-3 rich fish may have lower levels of inflammatory markers in their bloodstream. Lower inflammation means less stress on the prostate, and less stress means healthier cells. Now let's talk about a small food that carries enormous power: pumpkin seeds. Tiny, crunchy, often overlooked. But inside these seeds is one of the most important minerals for male health: zinc. The prostate contains one of the highest concentrations of zinc in the human body. This mineral plays a critical role in hormone balance, immune function, and tissue repair. When zinc levels fall, the prostate becomes more vulnerable to inflammation and enlargement. Studies have found that men with prostate problems often have lower zinc levels than healthy men. That is not a coincidence. It is a warning signal. A small handful of pumpkin seeds each day can help replenish this vital nutrient. No prescription, no complicated routine, just a simple habit repeated consistently. Now let's move to something many people drink every day without realizing its protective power: green tea. For thousands of years, green tea has been used in traditional medicine. Today, modern science is finally catching up. Green tea contains natural compounds called catechins, powerful antioxidants that help protect cells from damage and reduce inflammation. Laboratory studies have shown that these compounds can slow the growth of abnormal prostate cells and support healthy tissue function. 1 cup, 2 cups, a quiet ritual that strengthens the body from within. But here is a habit that is even more basic and often ignored: water. Dehydration is far more common than most people think, and chronic dehydration places stress on the urinary system, including the prostate. When the body lacks sufficient fluid, urine becomes more concentrated. This can irritate the bladder and prostate, increasing inflammation and discomfort. Hydration is not just about thirst. It is about circulation. It is about detoxification. It is about cellular health. Every glass of water helps flush waste products from the body and supports normal urinary flow. Simple, essential, powerful. Now let's step beyond food and talk about movement, because the human body was not designed to sit for hours at a time. Modern lifestyles have turned many men into sedentary observers of their own health, sitting at desks, sitting in cars, sitting in front of screens, and inactivity has consequences: poor circulation, weight gain, hormonal imbalance, increased inflammation. Research has shown that regular physical activity improves blood flow to the pelvic region, supports hormone regulation, and reduces the risk of prostate disease. You do not need a gym membership. You do not need expensive equipment. You need movement, a brisk walk, 30 minutes, 5 days a week. That single habit can transform metabolism, reduce inflammation, and strengthen the immune system. Now consider sleep, the most underrated medicine in the modern world. During sleep, the body repairs damaged tissues, balances hormones, and regulates immune function. But millions of men live in a constant state of sleep deprivation. Late nights, stress, screens, interrupted rest, and the consequences are serious. Studies have linked poor sleep to increased inflammation, weakened immunity, and higher risk of chronic disease. When sleep suffers, the body loses its ability to heal. 7 to 8 hours of consistent sleep each night is not a luxury. It is biological maintenance. Now let's talk about weight. Excess body fat is not just stored energy. It is active tissue that produces inflammatory chemicals. These chemicals circulate through the bloodstream, placing constant stress on organs, including the prostate. Men who are overweight or obese have been shown to face a higher risk of aggressive prostate disease and worse health outcomes. But even modest weight loss can make a measurable difference. 5 kilograms, 10 pounds. Small changes in body weight can reduce inflammation and improve hormone balance. This is the power of consistency, not perfection, consistency. And here is the most empowering truth of all. Your prostate health is not determined by one meal, not one workout, not one night of sleep. It is determined by patterns, daily patterns, weekly patterns, lifetime patterns, the foods you choose, the steps you take, the hours you rest. These habits shape your biology in ways you cannot see until years later. But the good news is this: change begins immediately. The moment you add more vegetables to your plate, the moment you choose water instead of sugary drinks, the moment you step outside for a walk, the moment you go to bed on time, your body starts responding. Inflammation begins to fall, circulation begins to improve, cells begin to repair, and the prostate, quiet, hidden, often forgotten, begins to heal. Health is not built in hospitals. It is built in kitchens, in bedrooms, on sidewalks, in daily routines, one meal, one walk, one night of sleep at a time. And those small decisions, repeated over months and years, can protect your prostate, preserve your strength, and extend your life far beyond what you ever imagined. Most men believe health screening is a single moment, one appointment, one test, one answer. But when it comes to prostate health, that belief can be dangerously misleading because screening is not an event. It is a relationship. It is a long-term conversation between you, your body, and your doctor, a conversation that unfolds over years, sometimes decades. And the men who understand this simple truth are the ones who protect their health the longest. Here is a fact that surprises many people. A single PSA test result tells only part of the story. What truly matters is the pattern, how that number changes over time. Doctors call this PSA velocity. It is not just about how high the number is, it is about how fast it rises. A slow, stable PSA level over several years is often reassuring, but a sudden increase, even within the normal range, can signal that something inside the prostate is changing. That is why regular monitoring matters, not panic, not fear. Monitoring. Because prostate cancer rarely appears overnight. In most cases, it develops slowly, silently over many years, long before symptoms appear, long before pain begins, long before daily life is affected. This slow growth gives us something incredibly valuable: time to detect, time to evaluate, time to act wisely, but only if we are paying attention. Medical studies have shown that men who participate in regular screening discussions with their healthcare providers are more likely to detect problems earlier and receive less aggressive treatments. Earlier detection often means smaller tumors, less invasive procedures, faster recovery, better quality of life. This is not theory. It is documented reality. Yet millions of men avoid screening conversations altogether. They delay appointments. They ignore symptoms. They hope problems will disappear on their own. And hope is not a medical strategy. Here is another critical truth. Not every man needs the same screening schedule. Health is personal. Risk is personal. Decisions must be personal. Age plays a powerful role. After age 50, the risk of prostate problems rises steadily. After age 60, the risk increases even more. By age 70, prostate disease becomes one of the most common health challenges men face. But age is only one piece of the puzzle. Family history can double or even triple risk. If a father, brother, or close relative had prostate cancer, your chances of developing the disease are significantly higher. That genetic connection is not destiny, but it is a signal to start the conversation earlier. Lifestyle also matters more than most people realize. Men who are physically inactive, overweight, or living with chronic conditions such as diabetes or high blood pressure often face higher levels of inflammation and hormonal imbalance. These factors create an environment where disease can grow more easily. That is why doctors look at the whole person, not just a single test result. They consider weight, diet, activity level, sleep patterns, medical history, medications, stress levels, because the human body is not a machine with one moving part. It is an interconnected system, and when one system struggles, others often follow. Now, here is something many men do not expect to hear. Sometimes the best medical decision is to wait. Yes, wait. Modern medicine has moved away from rushing into treatment for every detected prostate cancer. Instead, many men are placed on a strategy called active surveillance. This means the cancer is carefully monitored with regular tests and exams, but treatment is delayed unless the disease shows signs of progression. This approach has changed lives. Research has shown that thousands of men on active surveillance live for years, even decades, without needing surgery or radiation. Their cancer remains stable. Their daily function remains intact. Their quality of life remains high. This is the power of patience, guided by science. But patience only works when monitoring is consistent. Skipping appointments breaks the chain of protection. Ignoring follow-up tests creates blind spots, and blind spots are where disease hides. Think of screening like maintaining a vehicle. You do not check the engine once and assume it will run forever. You perform regular inspections. You watch for warning signs. You make adjustments before small problems become major failures. Your body deserves the same attention. Here is another fact that may change how you think about screening. Many men who develop advanced prostate cancer had early warning signs years before diagnosis. Elevated PSA levels, mild urinary symptoms, subtle changes that seemed harmless at the time, but those signals were missed, not because the body failed to communicate, but because no one was listening. Screening is how we listen to the body. It is how we translate silent signals into meaningful action. And the earlier we listen, the more options we have. Options mean control. Control means confidence. Confidence means peace of mind. Now let's talk about fear, the hidden barrier that keeps many men from engaging in regular screening conversations. Fear of bad news, fear of procedures, fear of losing independence. These fears are real, but avoiding information does not eliminate risk. It only delays discovery, and delayed discovery often leads to more complicated treatments, longer recovery, and greater uncertainty. Knowledge, on the other hand, creates power, power to prepare, power to prevent, power to act early. And here is the most reassuring truth of all. Most prostate cancers detected through regular screening are found at an early stage. Early stage disease is often highly treatable. Many men go on to live full, active lives, working, traveling, spending time with family, enjoying retirement. Their diagnosis becomes a chapter, not the ending. But this outcome depends on engagement. engagement with healthcare, engagement with monitoring, engagement with the ongoing conversation. Because screening is not a one-time decision made in a clinic. It is a lifelong partnership with your health, a partnership built on awareness, consistency, communication. The men who thrive are not the ones who never face health challenges. They are the ones who stay connected to their health journey. They ask questions. They track changes. They show up for follow-ups. They understand that prevention is not a single action. It is a habit, a routine, a commitment repeated year after year. So if there is one message to remember, let it be this. Do not treat screening like a test you pass or fail. Treat it like a conversation that protects your future. Because the strongest defense against disease is not luck. It is attention. Attention to your body. Attention to your numbers. Attention to the signals that appear long before symptoms begin. And sometimes the most powerful step a man can take is not dramatic or complicated. It is simply staying engaged, year after year, test after test, conversation after conversation. That steady commitment, quiet, consistent, and informed, is what turns early detection into long life.